Gentlemen, have you ever wondered if your body simply shuts down certain functions as you cross the threshold of 60? Or have you been told that intimacy is a young man game and that you should just accept a quiet decline? Many men believe that stopping ejaculation is a natural part of aging, a graceful exit from a once active life, but as a urologist with over 12 years of clinical experience, I am here to tell you that this is one of the most dangerous lies you can believe about your own biology. What really happens to your prostate, your heart, and your brain when you stop this vital process after 60 is not just a matter of losing a bit of fun. It is a matter of systemic stagnation that can affect your longevity and your dignity. Today, we are going to pull back the curtain on the science of the male body in its prime second act, and I will share with you why keeping the pipes flowing is actually one of the most powerful health insurance policies you can have. Before we dive into the biological mechanics, I want to know who is in the room with us today, so please leave a comment below telling me which city or country you are watching from, because it is truly inspiring to see a global brotherhood of men taking charge of their health. I promise that by the end of this video, you will have a clear, science-based roadmap to maintaining your strength and vitality well into your 70s and 80s. So stay with me, because the third point we discussed today is something that even most doctors fail to mention to their patients. This is about more than just physical health. It is about reclaiming the energy and the drive that defines your masculine spirit in the modern world. The first thing we must address is the myth of the expiring clock, the idea that after a certain age, your body no longer needs to engage in the release of seminal fluid. Imagine your prostate gland, which is about the size of a walnut and sits right at the base of your bladder, as a small but vital reservoir through which a river must flow. When you stop ejaculating, that river becomes a stagnant pond. In medical terms, we talk about the accumulation of metabolic waste products and potential carcinogens within the prostatic ducts. Research, including a major study from Harvard, has suggested that men who ejaculate at least 21 times per month have a significantly lower risk of developing prostate cancer compared to those who do not. This is because the process of ejaculation acts like a biological flush, clearing out cellular debris and keeping the tissue healthy and oxygenated. If you stop, you are essentially allowing those pipes to rust. Think of a garden hose that has been left in the sun with stagnant water inside. It becomes brittle and the water inside becomes foul. Your body works on a use it or lose it principle, especially when it comes to the delicate vascular system that supports male performance. When we talk about erectile function, we are really talking about cardiovascular health. The small arteries in the pelvic region are the first to show signs of restricted blood flow, often years before a heart attack or a stroke occurs. By maintaining regular activity and ejaculation, you are forcing those vessels to dilate, a process mediated by a miracle molecule called nitric oxide. Nitric oxide is what keeps your arteries flexible and your blood pressure stable. When you stop, the production of nitric oxide in those specific tissues drops, leading to a cycle of atrophy where the smooth muscle cells in the penis are replaced by collagen or scar tissue, making future performance much more difficult. This is why I often tell my patients that their performance is the canary in the coal mine for their heart. To support this, you must focus on foods that are rich in nitrates like beets and arugula. These vegetables provide the raw materials your body needs to manufacture nitric oxide. When you combine these dietary choices with regular physical engagement, you are essentially performing a daily tune-up on your entire circulatory system. Now, let us look at the hormonal side of the equation. Testosterone is not just about muscle and sex drive, it is the fuel for your confidence, your cognitive clarity, and your bone density. While the act of ejaculation itself causes a temporary dip, the regular engagement of the endocrine system through intimacy signals to the brain that the body is still in a reproductive and active state, which helps maintain a healthier baseline of free testosterone. Men who withdraw from this aspect of life often experience a sharper decline in mood, leading to what we call andropause or male menopause, characterized by irritability, fatigue, and a loss of purpose. I remember a patient of mine, a 72-year-old retired engineer who came to me feeling like a ghost of his former self. He had stopped all intimate activity 5 years prior after his wife passed away, thinking it was no longer necessary or appropriate. His energy was gone, his levels were creeping up, and he felt a deep sense of disconnection. We started him on a protocol of regular pelvic floor exercises, specific nutrition like pumpkin seeds for zinc and cooked tomatoes for lycopene, and encouraged him to reconnect with his own body. Within 3 months, he told me he felt like he had woken up from a long sleep. His morning energy returned and his sense of self-worth was restored. We also need to consider the neurological benefits. During the peak of release, your brain is flooded with a cocktail of chemicals including oxytocin, which is the bonding hormone, and dopamine, the reward chemical. These neurochemicals act as natural stress reducers, lowering cortisol levels, which are often chronically high in older men. High cortisol is a killer. It causes belly fat, destroys sleep, and weakens the immune system. By maintaining a healthy frequency of release, you are essentially giving your brain a reset button that protects you from the ravages of chronic stress. Many men ask me if it is okay to use self-care or if it has to be with a partner. The biological benefits of the flush and the hormonal signals are present regardless, though the emotional connection with a partner adds another layer of oxytocin that is incredibly beneficial for heart health. However, the most important thing is the consistency. If you have been inactive for a long time, do not expect everything to work perfectly on day one. You have to treat your body like a classic car that has been sitting in a garage for a decade. You do not just redline the engine immediately, you change the oil, you check the spark plugs, and you warm it up slowly. This means starting with walking 30 minutes a day to improve overall circulation, staying hydrated with a pinch of sea salt in your water to ensure your cells can actually absorb the moisture, and perhaps using a vacuum erection device if things have become very dormant. These tools are not signs of weakness, they are pieces of medical equipment designed to rehabilitate the tissue. Another critical factor is your diet. I want you to think about the Mediterranean diet but with a specific focus on prostate health. This means plenty of healthy fats from avocados and olive oil, which provide the building blocks for hormones, and berries, which are packed with antioxidants to protect the DNA in your prostate cells. I also highly recommend a daily dose of high-quality cacao or dark chocolate, as the flavonoids in cacao are scientifically proven to boost nitric oxide production. When you combine these nutritional strategies with the physical requirement of regular ejaculation, you are creating an environment where your body can thrive rather than just survive. There is also the issue of the pelvic floor muscles. Just like your biceps or your calves, the muscles that support your bladder and your reproductive organs can become weak and saggy if not used. Regular activity keeps these muscles toned, which actually helps prevent the common problem of urinary leakage, or that annoying drip after you think you are finished at the urinal. It is all connected. The ability to control your bladder, the ability to perform, and the health of your prostate are all part of one single system. When you stop one part, the whole system begins to degrade. I have seen men in their 80s who maintain a twice-weekly schedule of release, and they have the vitality and the sharp minds of men 20 years younger. This is not a coincidence, it is biology. To go deeper, we must talk about the hydration method, which stands for adjust, soften, integrate, and manage. Many men over 60 stop ejaculating because they are exhausted by the need to wake up multiple times at night to urinate. They think that by shutting down their sexual health, they might somehow fix their bladder, but the opposite is true. By adjusting your water intake so that 75% of your fluids are consumed before 4 in the afternoon and softening your intake in the evening, you allow your body to process fluids without overloading the bladder at night. When you integrate electrolytes like magnesium and potassium, your heart and your smooth muscles, including those in the prostate, function with much higher precision. Managing your stress through the release of endorphins during ejaculation actually helps the bladder neck relax, making it easier to empty your bladder completely. This reduces the risk of urinary tract infections and stone formation. We also have to discuss the start-stop technique, which is a powerful tool for men over 60 to regain control and build stamina. If you have noticed that your sessions have become shorter or that you lack the intensity you once had, the start-stop method allows you to build up the sensation to a point just before release, then stop and let the sensation subside before starting again. This practice strengthens the neurological pathways between your brain and your pelvic floor, effectively training your nervous system to handle higher levels of arousal without premature fatigue. Furthermore, let us talk about the 4 golden vitamins for the man over 60. Vitamin D3 is the foundation of your hormone production, acting more like a hormone than a vitamin. Without it, your testosterone will crater. Vitamin B12 is essential for nerve health, and since the sensations required for ejaculation depend on healthy nerve endings, a deficiency here can lead to a loss of feeling. Vitamin C protects the delicate lining of your blood vessels, and vitamin K2 is the traffic cop that directs calcium into your bones and away from your arteries. If your arteries are calcified, they cannot dilate to allow the blood flow necessary for peak performance. By stopping ejaculation, you are essentially telling these vitamins they are no longer needed for their most vital masculine functions. Let us also consider the psychological halo effect. When a man knows he is still capable and active, he carries himself differently. His shoulders are back, his voice is deeper, and he possesses a sense of outcome independence that is incredibly attractive and commanding. This confidence spills over into your professional life, your hobbies, and your relationships with your children and grandchildren. I once had another patient who was 68 and had completely given up. He told me that he felt like his body was a betrayal. We worked on his nitric oxide levels using specific amino acids and watermelon rind extract, and we got him back on a regular schedule of physical release. He recently came back to my office and said that for the first time in a decade, he felt like he was the master of his own house again. He started a new business and even began dating. This is the power of biological momentum. When you stop, you choose the path of atrophy. When you continue, you choose the path of mastery. The refractory period, which is the time it takes to recover after release, does naturally lengthen as we age, and that is perfectly fine. It is not about speed, it is about the quality of the circulation and the consistency of the flush. In your 20s, you might have recovered in minutes, but at 60, it might take a day or two. This is simply your body operating with more deliberation. Use that time to focus on the emotional connection and the sensory experience. The goal is to keep the machinery moving so that the parts do not seize up. Think of the ancient clocks in Europe that have been ticking for hundreds of years. They do not work because they are new. They work because they have been wound every single day, and their gears have never been allowed to sit still. Your body is the same. The prostate is a secretory organ, meaning its job is to produce and move fluid. If that fluid sits there, it becomes thick and can lead to stones or chronic inflammation. Regular ejaculation keeps that fluid thin and moving, which is the best defense against the discomfort of an enlarged prostate. Do not let the fear of aging or the embarrassment of changing functions stop you from doing what is necessary for your survival. You have a responsibility to yourself to maintain this vessel. You have worked hard to reach this age, and you should enjoy the fruits of your labor with a body that is responsive and healthy. Start today by looking at your habits. Are you sitting too much? Prolonged sitting crushes the pelvic floor and restricts blood flow. Get up and move. Are you eating processed sugars that cause inflammation in your arteries? Switch to the nuts and seeds we discussed. Brazil nuts are particularly good because they contain selenium, which is a powerful protector of prostate tissue. Just 2 Brazil nuts a day can provide your daily requirement. Almonds provide the healthy fats and vitamin E needed for skin and tissue elasticity. Every small choice you make is a vote for either vitality or decline. Choose vitality. Your body is listening to the signals you send it. If you send the signal of inactivity, it will respond by shutting down. If you send the signal of engagement, it will find ways to adapt and thrive. This is the incredible resilience of the human spirit and the male body. You are not a victim of your age, you are the pilot of your destiny. Keep the engine running, keep the fluids moving, and keep your head held high. This journey is about more than just physical mechanics. It is about the quality of your life and the legacy of health you leave behind for those who look up to you. In conclusion, the path to mastering your health after 60 is not found in a magic pill, but in the consistent application of these biological principles. Remember that your body is a high-performance machine that requires regular maintenance, and the act of ejaculation is a critical part of that service schedule. By keeping the system flowing, you are protecting your prostate, supporting your heart, and nourishing your brain. I want you to take this information and turn it into an action plan. Start by focusing on your circulation through daily movement. Upgrade your nutrition with the foods we discussed, and do not be afraid to seek professional help if you encounter roadblocks. Please remember that this video is for educational purposes and does not replace a one-on-one consultation with your own physician, especially if you are experiencing pain or significant changes in your urinary habits. If you found this information valuable, the best way to support this mission is to hit the like button and subscribe to the channel so we can reach more men who need to hear this message. I want to hear from you, so please comment the word vitality below if you are ready to take charge of your second act. Sharing this video with a friend or a brother could literally change the trajectory of their health, so do not hesitate to pass this knowledge along. You are not just aging, you are evolving, and with the right tools, your best years are still ahead of you. Thank you for being part of this community, and I look forward to seeing you in the next video as we continue to unlock the secrets of male excellence. Always remember that your dignity and your health are in your hands, and it is never too late to start moving in the right direction. Stay strong, stay informed, and stay active.